Hello, my name is Simone Cooper, and this is my final project for Biology 129 Nutrition at Bates College, where I will be looking at how the Mediterranean diet helps reduce the risk of developing Alzheimer's disease. As a disclaimer, this presentation does not substitute professional medical advice and is purely for educational purposes. A little bit about disease. Alzheimer's is a progressive neurodegenerative disorder that mainly affects the memory, thinking, and behavior. And as you can see in this picture, Alzheimer's, as time goes on, the symptoms do worsen. Alzheimer's is the buildup of protein around the neurons, and it causes cell death, which causes the brain to shrink over time. And Alzheimer's is the most common form of dementia because it accounts for about 60 to 80% of all dementia cases. Alzheimer's affects over 7 million people in the US, as well as over 55 million people worldwide. And the ri- Alzheimer's is on the rise due to the aging population, and as we can see in these graphs, Alzheimer's mainly affects those who are 65 years and older. But as you increase in age, your risk does increase as well because 75-year olds and older, they are at more risk because they make up about 5 million of the 7 million people affected in the US. And then there is also an economic effect due to the increased need for a caretaker. The signs associated with Alzheimer's are memory loss, personality changes, trouble solving problems, as well as poor judgment and problems completing familiar tasks that an individual may have been able to do with no problem previously. And as the disease progresses, these symptoms can and will get worse. So, like I previously mentioned, Alzheimer's mainly affects the brain, more specifically, areas associated with memory and cognitive functioning, like the hippocampus and cerebral cortex. As you can see in this image, the cerebral cortex shrinks, and that is important because that is where new memories are formed. So, when it shrinks, memories can't be formed, which is why there are memory problems with Alzheimer's as a symptom. And then the cerebral cortex is responsible for language processing, which is why people who are in later stages of Alzheimer's also do sometimes experience language issues and are unable to communicate. And like I already said, Alzheimer's is the buildup of protein, more specifically in the forms of amyloid plaques, as well as neurofibrillary tangles around the neurons. And cell disruption also happens due to the loss of synaptic connections. And all of these things combined causes cell death as well as brain atrophy, which is brain shrinkage. To get diagnosed with Alzheimer's, they will do a comprehensive assessment, which could include medical history, and that would look at your family history because those who have a family history of Alzheimer's are more at risk for developing Alzheimer's. Cognitive testing, just to see if there was a decline in your cognitive ability. In brain imaging, such as CT and PET scans, to look at your brain to see if there are any changes. And these tests may not be a one and done thing. They often will be done multiple times since Alzheimer's is a progressive disorder. They want to see if your condition is improving or decreasing. For treatment, there are a couple of different options. There is first a cholesterase inhibitor, and that is for mild to moderate Alzheimer's symptoms. And it prevents the breakdown of important brain chemicals that are important for memory. And we also have immunotherapy drugs, and they target the amyloid plaques, to make sure that a patient may not get as many plagues in their brain. And the immunotherapy drugs have only been tested on people with early to mild cognitive impairment. So it is not suitable for those with severe Alzheimer's symptoms. And then there also is an NMDA antagonist, which is more suitable for those with moderate to severe Alzheimer's, just to ensure that individuals are able to live a longer life, a longer life using their daily functions that they are used to before Alzheimer's ultimately decreases their functioning. And there is no cure for Alzheimer's currently, but these drugs and treatments are able to allow individuals to live a longer, more fulfilled life, instead of being their full life being altered as much as it would without the medications. There are also other ways to improve Alzheimer's symptoms or reduce the risk of Alzheimer's. One being a dietary intervention, which could take form in the Mediterranean diet. The Mediterranean diet is a diet that is filled with healthy plant based foods and healthy fats, and its main goal is to cut out red or processed meat as well as added sugars. And it has been proven to reduce the risk of Alzheimer's, and this has been proven through surveys. So those who have said that they have taken on the Mediterranean diet have reported that they have not experienced Alzheimer's symptoms, even if they have been at a greater genetic risk. And the Mediterranean diet also supports cognitive health because the diet is filled with nutrient rich and healthy fats. Next, we're going to look at a case study of a woman who would be experiencing symptoms of Alzheimer's and how she could incorporate the Mediterranean diet to hopefully counteract some of those symptoms. So, Rebecca Johnson is a 76-year-old female who is 5'5", weighs 102 pounds, and has a BMI of 17. This profile fits somebody who would be at risk for Alzheimer's, or just because of her age. People who are over the age of 65 years old are at a much greater risk for developing Alzheimer's, as well as her BMI being underweight. Those who are experiencing Alzheimer's often forget to eat, so that would align with why she is underweight. For Rebecca's nutritional requirements, she should eat about 1,800 to 2,000 calories a day. And from those calories, 45 to 50% for intake should be carbs, 20 to 25 should be protein, and 30 to 35 should be fats. And the carbs are decreased from the normal standard, but protein and fat are increased. Protein is increased due to prevent muscle loss, because that is an issue with people who are experiencing Alzheimer's, as well as it helps neurotransmitter production. And then the fat increase is increased to account for the healthy fats in the Mediterranean diet. So for breakfast, she would have Greek yogurt with blueberries, strawberries, bananas, and walnuts, and honey. Two slices of whole grain toast with olive oil and green tea. For lunch, you would have a salad with spinach, grilled chicken, tomatoes, cucumbers, calamata, olives, quinoa, olive oil, and lemon juice as dressing, and water. And then for dinner, she would have grilled salmon and garlic with garlic, lemon, and olive oil, steamed vegetables, and brown rice. So this aligns with the Mediterranean diet, accounting for all of the um, needed nutritional requirements. And an alternate plan could be to have smaller portion sizes, because it is often an issue that people with Alzheimer's do refuse to eat, especially during later stages. So smaller portion sizes could help with that, but supplementing some of that food with meat snacks in the middle of the day so that they are still getting the needed calories, but they are not having to eat as much at one time. Thank you, and that's the end of my presentation.